Oh, everybody gets the same recommendations. Well, it's true, it's not true. Most people have about the same stiff joints. Put it this way, you don't work out. If you go to a health club, what do they recommend? Just about everybody works out 3 times a week. Mm-hmm. It's the same thing, right, because that's how we know we're going to get a benefit. So I can explain that away. Does that make sense? Right. So you've got the recommendations. Now you're writing on the pad. You've got the handoff either in the front or in the back. And remember, when I hand it off, it's a condensed version of the recommendations, right? It's a condensed version, okay? You're going to go do the call at night, okay? And here's another, it's an education, 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 a little education, chiropractic review, education. So you're hitting them about 5 times with basically the same information, right?
Now, you want to call at night, that same night, or is it the next day? Or
if they're in there at 6, you'll call them the next day. So play that out. If I got a really bad patient that came, I mean, he's acute, he's dying at 3, I'll call him at 9. If I got somebody not that, hey, I've been to chiropractors before, I'm just here for, I might call them the next day. You just call them. Mm-hmm. Okay, you're either going to call them that day or that next day, right? But that call is going to be powerful. That's a powerful call. You're hitting, hey, Mrs. Jones, how are you doing? You're going to handle better or worse, no different. I am worse. That's typical. Remember I said we can make you a little bit sore when we first start to work you out. Did you ice? Did you stretch? Mm-hmm. So I'm leading it right in. And here's the other thing. I'm answering their question and I'm hitting them right up with another question. Okay, because I'm going to control that conversation. Okay, well, how come I got sore? Well, that's typical of what we do. I told you might get sore. Remember, we're loosening up tissue that's not used to it. It's the same thing as you go to the workout. If you work out and I send you out for a mile, you're going to be sore. So that's typical. Did you get some ice on it? I'm going to control that conversation. Okay, you know what? Since you're so sore, I'm going to want to see you tomorrow. Let's get in for a quick adjustment. By the way, I already also told them that in the recommendations. If you're not 10 or 15% better, or if you're a little bit worse, which is common, we're going to get you back here right away. Cool? Call, home therapies. Next visit is important. And then we're scheduling the second visit, right? Okay, so on the
these are new patients that are call-ins.
These are, well, I've taken the new patient.
But they called in.
Yeah, they could walk in. Why would I process them any different if they walked in?
We wouldn't schedule a second visit for a new patient if it was a walk-in.
Well, if it's a walk-in new patient. Mm-hmm. So if I've never been seen in any of the joints and I walk in, you're going to process me the same.
Right.
And then you process the second visit the same. You don't schedule the first visit.
We don't.
Because they walked in.
Right.
The second visit I'm talking about.
Oh, so you want us to schedule the second visit?
Yes.
Yes.
Oh.
Okay, so here's...
All the wellness corners should be doing that.
Yes. Your wellness corner should be doing that. Now, here's what we're finding out.
I just remember the conversation with the schedule from the woman from Aurora.
Yes.
Trying to capture more call-ins.
Well, that's the first visit. That's the first
Right,
appointment.
but they're call-ins. That was the only...
No, it's everybody.
It's everyone.
Oh.
They're all the same. We're trying to get them in the
process
process
You're not going to set an
of...
appointment up and a walk-in because they're there.
Right, it's the second visit.
Yes. Now, the reason that we went to that is we're seeing a lot of patients don't come back for the second visit.
Oh, okay.
And if they come
I
back...
I just thought it was restricted to those call-ins, to get the call-ins to make an appointment because they're used to it. It's more of a commitment if they do it.
I think if they walk in, and say, hey man, I want to be seen next Thursday, then you'll schedule an appointment because we're going to schedule the first appointment
Right.
and the second. But if they walk in, I want to be seen right now, you'll be seen right now. Yeah. Right. And then you'll schedule the second visit. Okay, here's what Corey's using to the second visit. Okay, Dean, we went over a lot of information with you, didn't we? Mm-hmm. Yeah, lower back stretches. We went over your joint problems, muscle problems. You're going to start to ice. I want you to set up a second visit so we can make sure you got all the information. Okay? Because remember, how are we going to get them to do the home therapies? We're going to show them. We're going to send them a video. We're asking them on the call. And then we're following up on the second video to review all that stuff. right? And again, use your front desk. Don't be afraid to use that front desk. I use them all the time. I'm paying them. I'm using them, right? Use that front desk. What are you thinking about? You guys got good thoughts. Go ahead.
No, because the whole conversation, to me, I just knew about people calling in to schedule. I thought that scheduling book was just for people that called in to make the first one and the second one.
Yes.
But not walk-ins.
Well, the walk-in, if they're going to be seen by next Thursday, yes.
No, but even if they wanted to be seen right away, I didn't know the wellness coordinator was supposed to schedule them for a second appointment.
Oh, I see what you're saying. Yes.
I didn't know that.
Yes.
Why wouldn't they? Just I mean,
Right.
what's your thought on that?
Yeah.
Because they walked in.
But, so why
I
wouldn't
gave
they
them-
want to come back for a second visit?
Because I gave them my recommendations.
I'm not following your.
I'm not following you neither.
So they came in for their first visit, okay, as a walk-in. They got, their adjustment.
through the
and all that.
process.
Right, got their visit, like, here's my recommendations. So the recommendations are gonna set up the second visit, regardless if it's 1 day, 2 days, 3 days, and based on what they purchase. If they purchase a wellness plan, they're like, well, I only have to come in 4 times a week, 4 times a month, because I only have wellness plan.
Well, they got that opinion wrong.
Well, I know, but I think that's the psychology that when you go to sell them a package or a wellness plan, they see like, well, the wellness plan is only giving me 4 visits.
I agree.
But they don't, okay, so they throw out my recommendations. My recommendations are like, well, let's see, his recommendations are here, my wellness plan is here. I'm like, I'm going with the wellness plan.
Well, yeah, but here's what I'm going to tell you. So even though I recommended 2 to you, you're going to take that wellness plan. Remember, the wellness plan is only for the 4 visits. You're going to get another 6 visits in. They're only $10 a piece that month.
Right.
So that's how I clean that.
Well, I know the wellness coordinator tells them that, but
Right.
and that's the thing with me is that it frustrates me, to about here, that when I say, I need to see you this many times a week, they're still only coming in once,
Corey's experience with the second visit was she had the same problem. She sells a lot of wellness plans, and she wasn't getting people to do what she needed them to do,
Right.
which is come back again. So she set up the second visit and got them in a routine. She said that made a difference. That's why she does it. She sells almost all wellness plans and hardly any packages.
Right. But for some reason, I thought it was just call-in people trying to capture more call-ins than.
Well, listen, and that's another one of the piece. We think if they schedule, you're going to capture more of them. So you're right on that.
Right.
You are right on that. You're thinking, okay, if they walk in, we'll be able to capture them on the second. Not necessarily, but here, let me. This is a good point. I think I see my doctors fall more into that once a week routine than the patients.
Yeah.
You know what I'm saying? I think because there's a once a week wellness program, doctors are, hey, once a week. And then, you know what I'm saying? You want to
Well,
get.
yeah, I know that.
Yeah, so I think it's more, but you can cut that off.
Right.
Okay, just, make sure that they're telling him, we want to see you 10 times. Remember, it's 69 for the first 4, so your first month is 129.
Right.
You got 10 visits. It's
See, and
$13 a
that's
piece.
what I switched to before when I started out. I was like, okay, I need to see you 3 times a week for the first 2 weeks, and then I changed it up to kind of fit with wellness plan and packages.
That's what I'm trying to say.
I do
Don't
what you do now is like 8 to 10 visits over the next 30 days.
Yes.
So that's
don't-
what I do now.
Yes, doctors were falling in, hey, this is a once a week plan, so that's how I'm going to schedule and
Yeah,
do my
no,
recommendations.
no.
Get away from that. Okay, and I do think sometimes the patients fall into that, but no, I want you 10. Remember, your last
See,
6
I think the patient needs to hear that because
Yes.
we had a new patient the other day, and Devin really thought she was going to buy a package, but when she looked at the wellness plan, she's just like, well, if I get a package here and then this here, I save more money here, and so she went with the wellness plan instead of the 10-pack. And I've only, so she hasn't been in, since a week ago.
Here,
So she's not really following my recommendations.
Well, that's why Corey wants a second appointment. That's what she was having,
Right,
the
and
same
I
exact
think
experience.
the second appointment, they follow that.
yeah.
You
I've
tell
had
them
some
come
that
in.
no
Yeah,
sense.
they-
Well, and listen, you're going to. It's
Yeah.
not going to be 100%,
Right.
but I think we've got a better shot of them following your recommendations if they can repeat everything, because remember, on that, we're repeating the report of findings.
Well, see, and that was another, I don't know if that came in the group Texting was, you know, what was the purpose of the second visit other than getting another adjustment? Was it doing another, like, follow-up report of findings to keep them?
It's a follow-up on the home therapies.
Right.
Oh, okay.
Okay, so, hey, we're gonna review the icing, we're gonna review the stretches. And here's the other thing I always did when I did my report of findings in the old days with the computers, I'm sorry, with the x-rays.
Mm-hmm.
Okay, here's what I think you guys should do. Okay, Mrs. Jones, what did I say was wrong with you? Because first of all, here's the psychology of that. If I can get them to spit it out in their mouth and they're right, they'll start to believe it.
Yeah.
Yeah.
Something.
Yeah, they're gonna retain something. And have you ever known something, but you can't talk about it because it's not quite there yet?
Mm-hmm.
Okay? And once you're starting to be able to spit it out, then it cleans up.
Right.
Okay? And most of them will go, I don't know. Remember, you've got tight, stiff joints. These aren't functioning right. We're gonna have to loosen them up. That's right. What else? Remember those muscle knots. That's right. So you're stretching out those muscle knots. Okay, we're working on your sitting at the posture. Did you look at that? Did you look at that video? So I'm repeating all that in front of them. Does that make sense?
Right.
Okay. Any more questions? So your second visit, you're scheduled. You're repeating your report of findings. You're repeating your recommendations, and you're reviewing the home therapies. It's customer service, right? And it's patient-centered. What can I do myself is a huge question, especially our patients ask. That's all I'm talking about with you guys. Any questions, comments?
What if you get patients that go, okay, well, how did the knots get there? Okay, now when are my joints going to stop being unstiff? When I stop changing the things that I just go and, you know.
When we're gonna loosen them up.
Right.
Give us the first month. Let's see how you do after the 10 visit. It's kind of it's very similar to stretching the hamstring.
Yeah.
If you stretch a hamstring once a week for 4 weeks, you'll get loose. If you stretch a hamstring 3 times a week for 4 weeks, you'll be a lot looser.
Right.
So kind of, when are you gonna get loose? It depends on how well you keep your schedule,
Right.
how you're doing your therapies, your home therapies, okay? And once we get you there, then we're gonna go into the strengthening. So I'm gonna really try to put together a strengthening program over the next 30 days and teach it to the wellness coordinators, because that's the next phase we need to go in.
I know I gotta get you on top of that again.
Yeah, gotta get on top of it. Does your, how comfortable do you think your wellness coordinators are on doing the home therapies?
Very good.
Very good, cool, that's what I wanna hear.
I
Got it?
know Devin is.
So I don't have to worry about that much.
Yeah, Devin's not a problem.
Okay.
Yeah, in fact,
With the stretching part, and she knows the strengthening, but we haven't done a lot of that with her, so.
Yeah, and the icing?
Right.
Do you guys do anything with sitting at the computer?
no, I was just thinking of what, so I have things going through my head about maybe doing videos of, you know, someone sitting in a computer real bad all day. Here's where you are, here's correct position, you know, just.
Here's mine, because I'll show you my sitting at the video. Look at the sitting on the video on the
Oh, okay, I didn't know you had one.
Yeah, and listen, I'm gonna clean that up too. I'm gonna get rid of about half that stuff. Okay, so here's what Miss Dean, I want to go over some sitting posture with you, okay? Because you sit all day, blah blah blah. And here's how I start, Dean. If you do this, you're gonna die. You know, and they do. They laugh like that because they know. Okay, I know. So here's how I want you to sit. You ready? I want you to sit with the lumbar support right here. Do you know what a lumbar support is? About half will say yes, probably more, because it's in the chairs. It's in the cars, so most of them will understand. Yes, I know. No, I don't understand what that is. Do you know? Do you ever see the cars with the lumbar support, or that little thing that pushes your spine? Most of them at that point say yes. Okay, so I want you to sit with one and look at. Once you push out, this is a hard chair to show you. So once you push out that spine, the shoulders start to come back. From there, I want you to lean back 10 to 15 degrees. I want you to keep your elbows in. If you're on a mouse like this, you're gonna die. Okay, so the closer in the elbows, the less muscle contraction. Most ergonomic people put the screen right in the middle of the eyes hit the middle of the screen. For you, since you've got this stuff, pain, you're gonna lean back. I wanna move the bottom of the screen to the eye level so that you've gotta look slightly up. And we're gonna try that posture, okay? And if it doesn't work, we'll bring it down. Okay, and I always tell them, remember, ergonomics went right in, but for you, I'm gonna put it up a little higher, so they're tilting back in a little bit better posture. Now, if you don't like that, that's cool. I like it.
Mm.
Do you see what I'm saying? And my patients will do that. If they have a laptop, it's different. Here's what I tell them, same thing. So I go, I want this, I want you sitting back. You're on a laptop, that's terrible. I want you to raise the laptop like this. It can cause carpal tunnel. We'll worry about carpal tunnel if you develop it. Let's just see if you feel better like this. Because I just want to see if I can get them to feel better, right? Okay, now that listen, that's going to have a big effect because sitting is causing a lot of your patients' problems, isn't it? Is there any doubt?
Yeah.
It could be the number one worst posture thing we're doing.
Texting.
Texting is bad too, but I would actually think sitting is worse.
Yeah. I mean, I see a lot of people that.
Well, listen,
Texting or
the
even
research is starting. The more sitting you do, the earlier you die. Okay, you know. So I'm going beyond pain.
What I
Just
said
how-
is sitting is a new smoking.
Exactly.
Oh.
Yeah, sitting, and that's
That's actually a good.
No, you're right. An author said the sitting is the new smoking.
Is it really?
Yeah, they think it's that deadly. Okay, so I'm gonna repeat all that stuff. I'm getting a whole bunch of videos over to them, right? And if you don't like my sitting video, put some together. Because I had one doc goes, no, that's the wrong thing, because you're doing a lot of stuff at the suboccipital and you're gonna jam them up here. I don't know. What do you guys think of that?
It's possible.
Yeah, that's how I felt too. That's why.
It depends
That's
what you got going on. You know, the Atlas jammed there, maybe. It's
And I'm probably adjusting it too,
Right.
yeah. But I'm gonna go with my posture, and if it doesn't work or it makes them worse, we get out of it. That's what I tell my patients. It's pretty simple.
Yeah.
Any other
And we
questions?
do postural training, videos too. People that are, because there's a couple people that come through the Glenview that have standing desks. But we still having issues.
Well, here's what you're seeing at the standing desk a lot too. So they gotta, you know what I'm trying to say? There's a lot, and you gotta watch that.
And so I use the computer that we have in the clinics where it's all up off the wall, and I'm like, okay,